Howdy and welcome to another video edition of Remedy Land. Today I want to talk to you about receding gums. Although a lot of patients think about receding gums like a disorder which only happens later in life, that is not correct. Many different reasons can result in this form of periodontal condition, which makes it easy for patients of every age group and genders to encounter recession of the gums. These types of reasons consist of a current health condition, an absence of appropriate dental hygiene, an irregular position of the teeth and also high pressure to the oral cavity and periodontal region. Gingival recession or receding gums is a disorder in which the roots of the teeth come to be uncovered due to the reduction or decreasing of periodontal tissue. Dealing with gum recession is essential, not just for relief, but additionally to protect the healthiness of the teeth. Neglected, this disorder can result in larger threat of tooth decay as well as other oral problems, for example a bad bite, painful jaw, periodontal condition and also tooth loss. Based on the level of recession, therapies incorporate modifying brushing practices, dental deep cleaning by a dental professional and tooth surgical treatment to restore the periodontal deterioration. Receding gums are common with patients who encounter medical problems such as gingivitis or perhaps some kind of periodontal condition. When the gums start to recede, the tooth are getting tender to high temperature and low temperatures, developing a lot of discomfort. Sometimes, effective therapy of the primary condition are going to reduce the recession of the gums and also reduce most of the tenderness. However, receding gums are usually a typical natural part of the process of getting older in those over 40. Lots of individuals will be able to observe them significantly sooner than that. Occasionally gum recession could be determined by look or perhaps by sensing the top of the tooth at the gum line. Lots of individuals with receding gums seem like their teeth are notched towards the top. Pain is also a typical indication of receding gums, since the uncovered top part of the tooth is a lot more tender compared to the other parts, turning it into unpleasant to consume very hot or frosty meals and drinks. Weak oral sanitation may also result in the progression of receding gums. Unable to clean the teeth on a regular basis, flossing to eliminate tooth plaque accumulation between the teeth and also making use of a mouth rinse regularly can cause a variety of tooth troubles and lead to the recession of the gums. Like with gingival recession, gums that recede because of weak oral sanitation can result in raised tenderness and destroy the roots of the tooth in the long run. Hormonal variations. Variations in woman hormone levels throughout a woman's lifespan, for example in puberty, carrying a child and also menopause, could make gums extra tender and susceptible to gum recession. Periodontal troubles with this form may also occur because of difficulties with the teeth. The troubles might include teeth which are crooked and also usually do not fit as a group correctly once the person bites down. Tooth difficulties such as receding gums also can occur because of inappropriate positioning of crowns, tooth caps and fillings. Receding gums treatment, surgery. Each of those situations produce increased pressure on the tooth and also gums, as well as in turn reasons the gums to recede in the event that the stress is not lessened simply by getting the teeth straightened and also stabilized by a dental professional or oral operating specialist. Damage may also result in the progression of this kind of periodontal condition. As an illustration, a fall down or perhaps a car crash might include injury to the oral cavity and teeth. The final result is gums which are traumatized and also reveal much more of the tooth, together with the tooth roots. If this kind of process is the contributing factor for the receding gums, reconstructive surgical treatment that fixes the teeth and sends all of them straight into appropriate position is considered the most effective solution to preserve revealed tooth roots and reduce the additional tension. The remedy for receding gums is determined by what's leading to the recession. In case it's a result of misaligned tooth, in that case an orthodontist could possibly assist with braces or perhaps other accessories. For individuals who face receding gums because of extremely exuberant brushing, think about changing over to a gentle bristle toothbrush and also consult your tooth hygienist for suggestions to strengthen your system. The development of the receding gums could be slowed simply by giving up smoking and brushing on a regular basis. In considerably less serious conditions, doctors might suggest the usage of some form of medicine placed straight to the teeth to be able to relieve some of the tenderness and normal periodontal discomfort. Commonly, the medication is in fluid form, which is implemented along the periodontal line with the use of a natural cotton swab. Alternative doctors suggest the consumption of a few nutrients to reduce decay and re-establish a level of healthiness to the gums. For the people with critically receded gums, a graft from a different section of the oral cavity could be the best choice for therapy. In case the receding gums destruction is bad, in that case a dental professional could thoroughly clean every spaces or openings in the tooth and gums, and after that stuff all of them in with the components that prevents the gums from receding even more and also encourages redevelopment. Herbal and natural or home homeopathic remedies offer you significantly less intrusive options. Famous home homeopathic treatments consist of massage treatments the gums with mustard oil every day, or perhaps making use of a remedy of potassium phosphate, natrum sulfuricum and also silicon dioxide on the gums. Make sure to perform your individual study. Herbal and natural and also home homeopathic treatments aren't supported by the United States Food and Drug Administration, and also it's good to be familiar with any kind of negative effects or problems in which the treatment might be contraindicated. There are many forms of periodontal tissue graft methods, however the most typically employed one is known as the connective tissue graft. Within this treatment for receding gums, a flap of skin layers is sliced at the top of your oral cavity, and tissue from under the flap, known as subepithelial connective tissue, is taken out, after that stitched to the periodontal tissue adjoining the uncovered tooth root. Consistent cleanings to eliminate tooth plaque accumulation along with therapies for potential periodontal condition must be performed where suitable. Even though many individuals are vulnerable to receding gums because of heredity, early periodontal deterioration might be eliminated with appropriate oral sanitation such as everyday brushing, flossing and also constant appointments to a dental professional. A lot of dentists recommend clients to concentrate most on appropriate flossing, claiming that it is a lot more crucial compared to brushing only. Individuals who have modest or severe periodontal disease, especially individuals with associated gum recession, needs to be checked by their dental surgeon frequently to look for pockets in the periodontal along with bone reduction. Protection, early medical diagnosis and intense therapy are going to assist in preventing loss of teeth and also receding gums. It must be mentioned that although a lot of these treatments is going to stop any kind of ongoing destruction of the impacted tooth and gums, not one of these will be able to reverse the deterioration that's previously been completed. Additionally, not one of those solutions is going to do too much good in case the affected individuals makes minor attempt to brush teeth correctly, floss or stick to all other suggestions their dental professional may create. Keep in mind that appropriate oral hygiene as well as regular appointments to your dental professional are the most effective solution to preserve sound oral healthiness. I hope you've enjoyed this video edition. We'll see you again on another video edition of Remedyland. Take care.